Welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and we're featuring 8 excellent tri-state businesses. Now we have Greg Slepecki from 101 Mobility, Jamie Malinowski from Prima Yoga, Dr. Nathan Lockery from Aspen Dental, and Cookie Harris from New Image Hair Clinic. But right now, let's welcome Dr. Ian Bulow from Revive Upper Cervical Chiropractic. Welcome to Pittsburgh Living.
Thank you for having me.
Boy, you're here just in time.
Oh yeah?
Because this is a big stressful time and people are, it's all in here right now.
It is. There's so much stress around the holidays, and it's a shame. I love the holidays.
I know.
But we do see that a lot. Stress is pretty big right around now.
So tell us about the fact that it's called Revive and it's strictly upper cervical.
Sure. Yeah, the term Revive, I think, speaks to the need that we currently face in today's society. People are always looking kind of outside themselves for a solution, and really internally we just have to reconnect with that part of our body that keeps us alive and well. And at the end of the day, that's your brain. So when we choose to focus on the upper neck, that's why it's upper cervical chiropractic, is because it focuses in at the point where your brain and body actually communicate with one another. That's one of the most important areas of your body.
That's the command center.
Absolutely. They used to call it Houston control, you know, and today we could call it your central CPU. It depends, but really it is the command center. And when we have misalignments in the spine, it can create a miscommunication, a decrease in the brain-to-body communication. And that can affect anything as common as a headache to a carpal tunnel type syndrome, all the way to more complex things like an irritable bowel syndrome, a fibromyalgia, a chronic fatigue syndrome, vertigo and dizziness. And all these things are all neurologically controlled things. And so that's why we focus there.
So you brought something that's part of your diagnostic.
Yeah.
And it's a show and tell. It's so exciting.
It is a little bit of a show and tell. Every day in our office, we want to make sure somebody actually needs to be adjusted. We're not in this for, I know you actually had someone who does mobility in the future coming on the show. When you talk about spinal mobility, that's one part of the equation.
Right.
What we're really interested, though, is on the nerve fibers. It's kind of like going to a cardiologist with chest pain. He's more concerned about your heart.
Right.
I know the chest hurts, but he wants to make sure your heart's okay. When someone comes to us because they have neck pain or back pain or headaches, I appreciate that, but my main concern is on the spinal cord. Now, I can't feel the spinal cord with my hands, so what we do is we run a scan. And this little scanner here is run up the back of a person's neck. And what it does is it measures the temperature of the skin. So whenever there is a misalignment in one of these upper neck bones.
And this is it. This is the base of your skull.
Yep, this is the base of the skull. And if one of these neck bones actually twists out of line, it puts pressure on the spinal cord. And that creates temperature differences, hot spots. And that's what we measure with these scanners, is whenever one side of the neck gets hotter than the other side, we know for a fact, scientifically, research has shown, when there's a disturbance or an irritation or stress on your nervous system, the temperature of your neck will fluctuate from left to right. So what we do in our office is we scan everybody.
That's interesting, from left to right. So it will crosses that meridian, goes back and forth.
Absolutely, it goes back and forth.
And then out to your nerves, to every part of your body.
And that's it. And the really cool thing about upper cervical is we do this on every visit, before and after.
So you know where it is.
Absolutely. So we can gauge the progress of someone's care over time. I mean, I wouldn't go, everyone's flying around the country this time of year, and I would not recommend going in a plane that does not have any gauges. Right? It would be a bad idea to take a trip to LA if you did not have your proper gauges to know where you are.
So we have a problem, we just don't know where.
Exactly. So if someone is engaging in care for their health, I want to have gauges to see, are we slowly calming things down? Are they still irritated? Do we need to change what we're doing? We have to know what's going on. And so I find it very important.
And so now you do the adjustment, and then what goes on from there? Does it take several, or is it one time?
Well, I would say one of the most unique things about our practice is that we actually have a big, large room that have these relaxation suites where people will actually lie on their back for about 20 minutes after their adjustments. And people love that because it allows them a time to just settle in before going back into the stressful world that we live in today, right? And for us, it allows us to recheck them that day. So we expect to see changes in the inflammation that day.
So you scan them again.
Same
and
day.
look at this same.
Absolutely.
And see where has it moved? Is it lessened?
Yeah. And see, it serves for two purposes. We want to make sure that we've removed stress from that person's body. And the other purpose is someone might feel fine, but we want to run a scan to make sure that they're actually doing okay.
Right.
I mean, everybody recommends having your heart checked every once in a while, having your teeth checked once in a while.
Right.
We should be checking the spine to make sure there's not inflammation that's brewing that could be causing who knows what kind of problems down the line, right? So we use these tools and these instruments to make sure that someone's doing okay when they think they're doing okay, and to make sure that our services are actually benefiting them the way that we say they are.
Well, we're almost out of time, but I want to make sure that you tell folks where you are.
Sure, yeah. So we're in Cranberry Township. It's one of the most accessible areas in all of Western PA. We're one of 6 offices in all of Western PA, and so there's not too many of us around.
Yeah.
And folks can give us a ring, give us a call. We'd be happy to run a scan on them, see if there's any undue stress that we can help them correct, and kind of take it from there.
Right, we've got all your information up on the screen. We have your website and your phone number, and good to see you again.
Yeah, it's nice to see you as well.
And if you want some more information about Revive Upper Cervical Chiropractic, you can call Dr. Bulow at 724-772-7060, or you can log on to revivepittsburgh.com. Now, if you'd like to advertise your products or services on Pittsburgh Living, you can give us a call, 412-575-2400, or you can email us at showcase@kdka.com. Now, up next, we have Greg Slepecki from 101 Mobility. That is next when Pittsburgh Living continues.